if somebody, you said usually most people come when they're feeling unwell, maybe they've already lost 60% of their kidney function. If somebody has lost 60% of kidney function, is he at the stage where he has to be hooked up to a machine?
Okay, so no. Now, kidney disease, we stage kidney disease into 5, okay, based on how much kidney function has been lost. Okay, now most people don't have symptoms until they get to stage 4, at which case they have about 30% of kidney function left. Okay, now usually it's at that time that they develop symptoms. Okay. The symptoms they would notice at that time are increased foaming of the urine, swelling of the feet and face, easy tiredness. Okay, if you don't come to hospital, then they can develop weakness, poor appetite. Okay, then they become nauseous and start to vomit.
Even those can be ignored, don't you think?
So, and that's the problem, that if you don't then seek appropriate care, then you go round and round until the point at which the kidneys are failed completely.
There's a picture on the screen now. What is this? Is this one of the complications of?
Okay, so most it's not a complete picture. It shows just the distal part of the hand. Okay, I would think that this person has a fistula and is having dialysis, but you can see the fingers are swollen.
Yes.
Okay, and so you can have body swelling, including the fingers and kidney. But this is beyond just the kidney disease. It must be that he has a fistula or has diabetes in it.
Okay. So you were telling me about this 60% function and
okay,
how
good.
it works.
So now, once they start to have symptoms, okay, the earliest things, swelling, frothiness of or foaming of the urine, okay, and tiredness, okay, but that's when many of them come to hospital. At times they come at the point where they still don't need to be on dialysis, okay. However, in a relatively short period of time, they would then require some kind of help for their kidney, okay, or for kidney function, which could be dialysis or then requiring a transplant, and that's the challenge we face.
Okay, if you look at the screen again, I saw this mentioned as, one of the symptoms of, a kidney disease. They called it a uremic frost.
Okay.
What is that?
Okay, so now, uremic frost is one of the skin manifestations of kidney failure. It's not very
failure?
Yes. So you don't see it in people who don't have kidney failure already.
Okay, so it's an end-stage manifestation.
And it's not usually this prominent in blacks anyway,
okay,
prominent in white. And we think that it's, you see, apart from passing waste in the urine, we also pass some waste in our sweat.
Okay.
Okay, so some of the urea that we pass in the urine also comes out in our sweat.
Okay.
And when you sweat, and then there's a high amount of urea in your sweat, and this water evaporates, and what is left on the skin, the testicle, what looks like that, and that's what is
okay. Can that be washed off with bathing?
Yes, it can.
Okay, so it's something that can also be ignored.
Yes.
So this is like a silent, destroyer, really.
Okay, so kidney disease is really a silent destroyer, and the reason is this: what we require to be symptom-free is actually about 25% of the kidney function that we are born with. Mm-hmm. Okay, the remaining 75% is some kind of kidney reserve that when we are under stressful situations like illnesses and we require extra kidney function to excrete excess waste, then we can use the extra.
Okay, so our body has formed a kind of backup.
So when people start when they have kidney disease, what they first lose is the backup.
Okay.
Okay, and that's why they have no symptoms.
All right.
So they have to lose all the backup first before they then start to have symptoms. And that's the challenge with chronic kidney disease, that they lose the backup slowly over a long period of time. And then by the time they then eat into what actually works when there's no stressful, so that's when they start to have symptoms.
Now, first of all, you spoke about acute kidney
injury.
Yeah. It's like the names have changed. Before, we just used to hear nephritis.
Okay. Nephritis is a medical term. It's not the same thing as kidney. something as acute kidney injury or chronic kidney disease. But you're right, the terminologies have changed. We used to say acute renal failure, chronic renal failure, but we've modified the term to suit what we now know about it.
Okay, because the knowledge has broadened.
Yes, so you remember that I said in the past it was only those who had kidney failure that we required as having chronic kidney, and that's why we say chronic renal failure. Okay, but we now know that the disease has been on for many years before they then have failure. Okay. So we've changed that term to mean chronic kidney disease. So it tells us that it's a spectrum, okay, and that failure is just the end point of that spectrum.
Okay, so concerning the acute, I just want to ask you first, is it the lesser of the two evils, the acute, the chronic? Something
I wouldn't say so. Okay, I wouldn't say one is less than the other. Okay, like I told you, the acute kidney injury is usually part of some other form of severe illness, okay, that patients have. Okay, and the kidneys fail as part of the illness.
Okay.
And usually what happens is if you're able to treat that illness, okay,
you can handle the
kidney tends to recover as the person recovers from the illness.
Okay. We have a caller on the line. Hello.
Hello.
We have Michael on the line. Can you give us your question or your comment?
Yeah. Thank you, doctor.
Could you just turn the volume of your TV set down a little bit?
Okay.
Okay, let's go.
Yeah. Please, I would like to ask this question. My mom is doing that, not kidney problem per se, but she was told that, there's a pipe that leads to the kidney. That's some pipe, and that's really raising her blood pressure. So the doctor said she needs to go through operation. But he said that this other new medical technologies that could be blasted, but the stuff in the pipe could be blasted, but he's not too sure if we have that area now or she needs to be flown abroad. So I want to know if it's necessary for us to go through the operation or to use the technology which will blast what is blocking the pipe that leads to the kidney.
Okay. Thank you, Michael. What's this about, a blockage in the pipe?
Okay, so when we're talking about the commonest causes, I said obstruction of the urinary tract.
Okay.
Now, the kidneys make the urine, okay, but the urine has to come out from the bladder. So there's a tube called the ureter that links the kidneys to the bladder where the urine is stored until we are comfortable to pass urine, okay? Now, if there's an obstruction to the flow of urine anywhere along that line from the kidneys down to when it comes out, then it can backlog urine, okay, and then damage the kidney. And I think that's what's happened in this case, some kind of obstruction along somewhere on the path. Now, what needs to be done is to relieve that obstruction.
Okay.
Okay, like his doctor has said. Like, it can be done surgically, okay, but there are also non-surgical interventions that can be used to relieve some obstructions. Okay, so you can pass a tube through whatever is the obstruction is, okay, inflate that area that is obstructed and put a stent to keep it open. Okay, but that depends on exactly what is causing the obstruction. Okay, because for some, you need to have some surgical intervention.
Okay.
For some, this other technique is available that can be done. So the first thing is what is causing it and then deciding what to do after that.
We seem to have another caller on the line. This is Ayoade from Ibadan. Ayoade, could we have your question or your comment?
Good afternoon.
Good afternoon.
Please, I want to ask the doctor. I've been having pain by my side and at the back. That one at the back. I've been having pain. So when the doctor was speaking now, then I know when I urinate, you don't use to foam. I don't know whether the foam is normal or not. So I want to ask you, maybe it's normal or I should go to the hospital.
Thank you. Okay. So is this normal?
So she has pain in her back. I'm assuming that's somewhere here. Okay, and that's where the kidneys are located.
Lower back?
Yes, so mid-back.
Mid-back.
Okay, on both sides. That's where the kidneys are located. And so when people have pain there, one of the possible causes is something going on in the kidney. Doesn't mean, most times it's not, But she needs to have evaluation. She needs to see a doctor who will then assess her. Okay?
But really, if you have pain, you should see a doctor, shouldn't you?
You should. Okay? So the doctor would assess her and decide what the cause of the pain is. Okay? And then appropriately advise her what to do next. Okay? It would involve checking her urine. Okay? And doing imaging of the back and all that to decide exactly what the problem is and then appropriately advise her.
Okay. I really wanted us to talk about acute and chronic, but let's go to prevention because we might run out of time.
Okay.
How does one behave or what does one take to perhaps prevent or reduce the risk of one getting kidney disease?
Okay, so we're going to look at prevention in 2 ways. Okay, we're going to look at people who have, who don't have any risk factor for kidney disease. Okay, and then people who have risk factors for kidney disease. Okay, so for those who don't have any risk factors, no hypertension, no diabetes, nothing. Okay, what they need to do is to keep a healthy lifestyle.
And that would be?
Eat less salt, exercise, don't put on weight, and have a routine medical check. Okay, regularly. It's very important to do that. Okay. So, very important, salt, weight reduction, exercise, and routine medical checks. We need to have that. That then helps us. So if you don't eat salt and you exercise, you don't gain weight, you're not likely to develop hypertension and diabetes. Okay? And that's 50% reduction in risk because if
then routine medical
checkups.
checks.
So if there's
if you're less than 40 once a year, and
if you're above that, up twice a year.
Okay.
Now, if you already have hypertension, diabetes, one of those other conditions I've mentioned to cause kidney disease, then in addition to all these other things I've said, you need to then control either the hypertension or diabetes. Okay, that involves taking your medications as prescribed by the doctor. It also requires that you visit your doctor regularly. Okay, and the frequency of hospital visit depends on several factors. So your doctor will determine if he needs to see you every month, every 2 weeks, every 3 months, depending on how he assesses the severity of the problem. Okay, and once you're able to do that, then you can reduce the risk of those conditions causing kidney disease. Okay, and those are 2 ways that's 2 ways I like to look at it. Okay, for people who already have kidney disease, then they need to be under the care of a kidney disease specialist, and that's very important.
Doctor, it's been very wonderful talking to you, very enlightening. There's so much more, but we have to stop here. We've run out of time. Thanks so much for coming on the program. And thank you out there for staying with us on Health Matters. Remember, you need a checkup, no matter how healthy you feel. It's been Health Matters. I am Mary Alale Yusuf. Have a great day.